Hello and welcome. Tonight we're going to be talking about Lyme disease as well as several other infectious diseases. I've talked to so many people in Minnesota and Wisconsin who are so concerned about Lyme, and I'm sure many of you have lots of questions, and we have the right man here to answer some of those. My guest is an infectious disease doc. Frank Rhame is back. He was on the show years ago, so it's wonderful to have you back. He's now at Abbott Northwestern, where he is head of the research division of Clinic 42.
Well, I should, of Clinic 42, not all of Abbott. There are a bunch of people doing research there besides me.
You're head of the Clinic 42 research.
The HIV and hepatitis C part. Yeah.
Correct, right. You're also an adjunct professor at the University of Minnesota.
True.
In the Department of Medicine, and then an adjunct associate professor at the School of Public Health at the U.
Yes.
So your ties to the U go way back, don't
Yes.
they? He's won many, many awards. He has been named one of the top doctors in the United States. So we're delighted you could come and join us and talk about this very puzzling, very controversial too, disease. Just tell us briefly, Frank, and I think people have heard, but just to review, how the Lyme disease gets from animal to person.
So it's a bacterium. It's a spirochete, which means it's kind of a spiral long bacterium that gets to us from ticks, Ixodes scapularis, specifically in this part of the world. They bite us, and after about 36 hours of being attached to us, they can transmit the organism to us, and at that point an infection starts. Most of the infections actually go away on their own, but we think antibiotics are worth using for everybody that's recognized as having acute disease. And that's usually doxycycline, which I'm sure we'll be talking about a bit. Mm-hmm. So the standard infection, which is the tick bites you, you get an oval or round or bullseye rash that's at least 4 centimeters, they were that big or more. You feel crummy, you may have fever. Usually we get the doxycycline started in a day or two after that happens. If the physicians are alert to it, in this part of the world, most of the physicians are pretty alert to Lyme disease, and it goes away. If it's untreated, there are a number of unusual complications. It can cause heart problems, it can cause nerve problems,
arthritis,
chronic form of arthritis, and so there are a couple % of people do have these more complicated issues, and therein lies the complexity of the illness.
Right. I want to mention too, it's the deer tick, not the ordinary wood tick that we see more commonly.
Exactly, black-legged deer tick that does it.
And they're tiny. And what I think is tricky is, as you said, if you can get it off when it's on your body, within, you said 36 hours. I've heard 24, 48, but 36 is your...
Well, that's what the current guidelines are using, 36 hours.
Okay.
So that affects this issue of whether or not you should take a dose of doxycycline having just found the tick. So if you can judge from what the exposure interval was or by how engorged the tick is when you find it, that it's been on you for more than 36 hours, then many people would recommend a single dose of doxycycline in that situation. If you're
just
pretty darn sure
precaution.
It's less than 36 hours, or if you're in an area that doesn't have a lot of Lyme disease, most people would suggest it's not worth it.
And just wait and watch and be alert. But the difficulty in diagnosing gets more complex, I've heard, because not everybody gets the bullseye rash.
Right. So maybe 20% of people don't get the rash.
Okay.
And when we first see people, they haven't made the antibody yet. So antibodies are things we make in response to foreign antigens, whether it's bee pollen or a rose bush thorn or measles virus, or in this case, the Lyme spirochete, the germ. It takes us a while to make the antibody. So usually when the people present to the doctor sick, they don't have a positive antibody test yet because it takes a while to develop that.
And that would be a blood test, but you maybe shouldn't even rely on that at all,
So
should
absolutely, you should absolutely not. So if you're in a Lyme endemic area, a place where there's lots of Lyme disease, and you have an unexplained febrile, crummy illness, feeling crummy illness, that doesn't have a standard explanation. So you've got a runny nose and a sore throat, that's a cold, you know?
Right,
If you've got
right.
urinary urgency, it's a urinary tract infection. But if you just have fever and feeling crummy and you had a tick exposure in a place where there's lots of Lyme disease, you should get the doxycycline and not worry about the test.
And not wait for the blood test results.
Because blood tests will be possible for a week or two or maybe even more.
And another complication I've heard about is that if you have had Lyme disease, and you've got the positive antibodies, you're going to test positive all the rest of your life.
Antibody tests, antibodies are things we make. They're proteins that circulate in our blood that are designed to combat invaders. I've got antibody to measles virus right now because I had measles when I was 6 years old. I'm going to have antibody to measles in my bloodstream until I die, but I don't have measles. You know, measles was when I was 6. So I'll keep making that antibody. So you have a person with a positive Lyme antibody test, it's a blood test. That person doesn't necessarily have active Lyme disease, doesn't necessarily have living Lyme spirochetes in him.
But it complicates things if you feel crummy and you've had Lyme disease, and this is a couple of years later, you go back, the doctor can't be sure if you don't know about a tick.
So a negative Lyme test makes it pretty unlikely that your crummy feeling is due to the Lyme spirochete, but a positive one doesn't really help you because you don't have a good way of diagnosing it.
After you've had it once, And then also I've heard that diagnosing is tricky because now there are 3 or 4 or 5 other diseases that the deer tick carries, and they can pile up.
Yeah, and that's a particular problem around here because we have a lot of anaplasmosis, we have some babesiosis.
These are the other
These are the
diseases.
two principal other ones. There are additional ones as well that are potentially tick-borne. In our part of the world, it's also Rocky Mountain spotted fever, different tick, and there's a viral disease, Powassan virus, that causes an encephalitis that's tick-borne. So ticks are bad guys for us, in particular, the Powassan doesn't necessarily go with the other two, but the Lyme disease and anaplasmosis very often go together, and that became very relevant because we had a doxycycline shortage. There are 2 other drugs that are pretty good for Lyme disease, but they don't cover the anaplasmosis. It's only doxy for the anaplasmosis. So that was a big problem when we couldn't get enough doxycycline because we couldn't cover those other diseases. And you can't really tell without rather tricky blood tests whether those other ones are present or not. So you just like to give the doxycycline to anyone who's had tick exposure and feels crummy.
Are those other diseases, Frank, do they present in a similar way, the kind of flu-like symptoms?
They all look pretty similar.
They do, so you can't, as a doctor, really know either.
Yeah. So flu-like is one of my hobby horses. Flu-like is a bad term because it means so many different things. So in fact, it's not like influenza at all, for instance. Influenza is a respiratory infection. You usually have runny nose and a cough. That's not part of this at all.
I guess I'm thinking of fever, aches, chills.
Right.
Part of some flus, not all.
Some people, when they say flu-like, they mean diarrhea.
Sure.
So
it's too broad.
It's a term which is unfortunate because it doesn't have enough specificity to it. So we're talking about a generalized illness and the anaplasmosis, babesiosis, Lyme disease, all 3 of them can be very similar in appearance. So the blood tests have distinguished them quite clearly, but to just seeing the person in the office, they all look the same.
And would you spell the anaplasma?
Oh no, anaplasma. It's ANAPLASMA.
Okay.
And plasmosis would be anaplasmosis.
And the other one is
babesia. Babesiosis is the condition caused by Babesia microti, the formal name of the germ. And there's been a new Babesia illness as well. If I get this right, I'll be doing well. Miyamotoi, a new Babesia species that has been established as causing human infection, also very similar to the Babesia that causes most of the disease, the one that we have here.
If someone's tuning in right now, they might say, what language are they talking?
Well, yeah, so that's what I love about infectious diseases. We have all these wonderful names, and we change the names too.
And we name diseases after people who discover them, right? In terms of where the Lyme disease and these others now are showing up, it's not just up along the St. Croix River anymore. It's not just up in northern Wisconsin. I mean, some cases are showing up right here in the metro area.
Yeah. So a lot of the cases that are attributed to people who live in the Twin Cities area are actually acquired in northern Minnesota. So they actually score it by where you live rather than where you acquired it. But there probably is Lyme disease in the metro area as well. I've pressed the health department on this very issue. They do collections of ticks, and they can find the bacterium in ticks. So they've clearly harvested ticks in the metro area that have it. The actual number of cases that appeared is less. So I presume that the fraction of ticks that are infected is less here. So in parts of our state, 20% of the ticks are infected by this bacterium.
That's a big percentage, isn't it?
Yeah.
And I read that, I mean, Lyme disease is showing up as far away as in Florida, and I mean, eventually it will probably be.
So some of this is climate change, particularly the Rocky Mountain spotted fever, which is actually a real bad actor that's tick-borne, different tick, as I said before. But many years ago, it was just in the southern tier of counties in Minnesota, but now it's coming farther north, presumably because of the climate change.
I'm not surprised.
Yeah.
Now, there's a post-Lyme syndrome controversy. Do people get a whole bunch of symptoms after being treated and after having an acute case? Tell us more what you know about this.
This is probably where the area of greatest controversy lies. So let me say, first of all, there are clearly long-term infections or syndromes, symptom complexes that the Lyme spirochete can cause. There's a cardiology one that causes heart block. There's arthritis that can go on. It can be present a year or two, principally in untreated people. And then there's some nerve infections as well. Like you can get a palsy. You can get a paralysis of a facial nerve. That happens, for instance. You get the asymmetrical mouth from that one.
Like a stroke look.
Yeah, exactly. And there's probably there undoubtedly is an encephalomyelitis as well, with elevated cells in the spinal fluid and abnormal imaging studies of the brain. So these things all exist. They represent a distinct minority of Lyme cases, but they all exist. So the controversy lies not so much about that. It's that if you give someone a month of say, IV antibiotics to treat those kinds of illnesses, which that month-long illness would be the month-long IV course of therapy would be the recommendation for all those more serious complications of Lyme disease.
The encephalitis related, the heart, the
arthritis too. All those things.
Okay.
So the controversy lies in people who have that month of antibiotics and have ongoing symptoms after that. And so here's a subtlety which is actually terribly important to me as a physician. It's whether or not people have objective or subjective abnormalities.
So measurable or
subjective
not.
abnormalities is I feel bad, I feel woozy, I can't concentrate, I sleep too much. These are subjective changes, subjective symptoms. Objective things would be if I have excess number of cells in my spinal fluid, if I have an EMG which shows that EMG is that thing where you stick a needle in there and you stick a needle in there and you look at the nerve conduction velocity. So these are tests which produce
very measurable tests.
Measurable objective abnormalities. So the majority of people who are concerned that they should get antibiotics longer than that month have subjective symptoms but not objective symptoms. So I get really nervous when somebody's got objective abnormality. If they have a psychometric testing, which tells me that their mentation is not working right, if they have an abnormal spinal fluid, if they have one nerve that isn't working right, area of numbness in one nerve, or they've lost a reflex. These are things which neurologists are particularly good at discerning. If they've got subjective abnormality, or excuse me, if they have objective abnormality, I get really nervous about whether or not more drugs should be used.
And you usually would tend to say, treat them with more drugs?
So subjective abnormality, I am
hesitant.
more willing to do. I'm sorry, subjective, just symptoms. I get very nervous about giving antibiotics. Because antibiotics are not safe. I mean, people tend to think that antibiotics are very safe, but they cause trouble. And one of the infectious disease, the orthodox infectious disease view, which I pretty much adhere to, although sometimes it makes me nervous, looks at a series of randomized trials where you basically give half the people with some of these symptoms an antibiotic and you give half of them placebo, and you see who gets better. And the people who got the placebo don't get any better than the people who got the antibiotic in these big trials.
That's important, isn't it?
And that makes me think that if you've already had these symptoms, you're not likely to benefit from it. Even if you did have a few living spirochetes in you, you're not likely to benefit from it. But in those trials, the people who got the antibiotic or the people who got the IVs, they get infection in their IVs.
Right.
The antibiotics cause a sludge in your biliary tract because it's concentrated in your bile. So there's a downside to these things. So you have to cautiously judge what you think is better for
Plus
the patient.
the resistance
Yes,
issue.
and we get a lot of problems with diarrheal illness now. This Clostridium difficile that our antibiotics cause, which has gotten to be a huge problem.
Right, that's a whole nother show.
Yeah.
But the people, Frank, who have the objective test results, you do want to treat them
So I'm more willing
further
to do that.
with more doxy? Is that the...
Or so it might be another course of ceftriaxone. It might be longer term doxycycline, because doxycycline is close to really safe. But really the people who are most vocal in their advocacy are generally people who do not have objective abnormality. And that's where this controversy gets really tough. And it's been very heated. I mean, I don't know how aware you are of some of these struggles, but they've been major struggles, even to the point of legislation and harassing the people who've taken positions one way or the other, and so it's been ugly.
There's a interesting, for the viewers, an interesting article in the New Yorker, July 1st issue, about what they call the Lyme Wars, and some of this comes out in that.
That's well described, yeah.
In terms of prevention, there is a product that I know you've mentioned called permethrin,
yeah,
which you put on your clothing, and that is to repel ticks.
Right.
Also DEET, and I wondered how much DEET do you think we should be putting on our skin, or how much gel with DEET in it?
A worthwhile thing, the reason that doesn't work on skin is because skin inactivates it, so it doesn't work.
It doesn't particularly hurt your skin, though?
It doesn't, but skin inactivates
It's no
it.
good,
So
okay.
you just spray it on the clothes or your bed clothes or your tent poles or what.
Okay.
So and that does help with it. So the DEET is actually the only side effects from DEET that have been described have been in infants, really. So they absorb too much through their skin. There has been DEET toxicity to infants, but for adults or kids over a couple of years, there really is not a downside to it.
Okay, that's good to know.
The practical
it seems to be creeping up the percentage in the...
So most people would want 30% or more. I don't know which one you have.
Yeah, this is 34%.
Yeah.
Just happens to be,
so,
what I picked up.
So, but that's probably what's around these days, because the 30% threshold has been advocated.
Okay.
The problem with DEET is that you sweat it off. So you need to reapply it if you're going to be good.
Okay.
So it is worth saying that the best way to deal with Lyme disease is to not get it in the first place, and
The socks
to-
over your pant legs,
yeah.
right?
So you can't get people to do that in the summer in Minnesota, but
I do it. I look
they
a
talk
little
about it.
strange, but
So the other thing you can do, which is actually good too, is to inspect your kids and yourself
yes.
when you get home before you go to bed. Look for those ticks, because if you do that once a day and you catch them all, you're all right. Now you alluded to one of the problems with that, because that
the
tick goes
nymph
through
stage.
yeah the tick goes through 3 stages, and the nymph is like half a millimeter. It's very, very easy to miss.
I mean, it looks like a
Yeah.
pencil dot.
Yeah.
So how do we ever find that on
Yeah.
a person
So compulsive moms should be able to do that.
with a magnifying glass? I was driving home once from northern Wisconsin and felt something in my hair, and sure enough, it turned out to be a deer tick. But I mean, that would be very easy to miss in someone's hair.
Yeah.
So it's
It's
hard
easy
to
to
be
miss,
too
yeah,
cautious.
yeah,
Do you think we're in Minnesota and Wisconsin getting a little too cautious or under cautious?
So you can drive yourself crazy by all this. You know, you
Yeah.
don't want to miss your summer at the lake because you're obsessed by Lyme disease. So you know, put it on your kids and yourself before you tramp through the woods, and where the tick likes to be is on a blade of grass hanging over a trail. How the heck the tick knows that it's hanging over a trail? I can't imagine. But if you
They've
go,
got a brain in that little body.
yeah, that somehow they figure out that I'm on a blade of grass that's leaning over a trail. I don't understand how to do that, but they're waiting there for somebody to go by, and they just grab right on.
So stay off grassy trails if you can. Huh?
So, I mean, how can you do that? you
Yeah,
know?
I know it.
But that's the area that you have to worry about. You don't really have to worry about your well manicured lawn going out there, or your pine needle forest bed. You know, it's when you start walking through those trails
Deep grasses.
that you're at risk. And you know, slather on the DEET and inspect your kids when they come home.
Well, all
Yeah.
of this is
Yeah.
so helpful and so informative.
Yeah.
We've just got a couple minutes left.
Okay.
And hepatitis,
We just started.
I know it. Hepatitis C, we're going to, I think, do a whole new show on it, because tell us just in a sentence or two.
There's a revolution in treatment of hepatitis C.
Very positive revolution.
In a couple of years, we're studying some of the new drugs. They're just absolutely gangbusters. So we're going to have
Great.
interferon-free regimens that are very well tolerated, that are 2 or 3 months long, with more than 90% chance of cure within 2 or 3 years.
That is so exciting,
yeah.
because it's really a silent epidemic in terms of
Right. So the whole
what, 200 million people have it.
Well, worldwide, the CDC's estimate is 3.1 million Americans,
Okay.
about 1% of Americans. But of the Americans who've got, a lot of them were baby boomers. That's up to 4% in that generation that was born between 45 and 65. About up to 4%, and right in the middle of that are infected. Half the people know about it and ignore it. Half the people don't know about their infection. So we need to get people tested who are at risk to prepare for these new regimens when they're coming along. And it's going to solve the problem, basically. It's going to really change the way we manage
That's
it.
one of the real bright spots in the field of new developments in medicine, isn't it? That's so exciting.
So
Great.
you asked about the new MERS coronavirus.
Yes, before I have you just speak to that, we're getting a signal. We want to put a web page up for you about Lyme, and then we'll see. We've got a minute or two left. For those of you who want to do more reading, more research, you can go to www.idsociety.org/Lyme. ID stands for Infectious Disease Society here. As we speak.
So that's the orthodox view. I should say, which I think is right, but there are points of controversy, but that would be the orthodox view.
Now we've got just literally a minute and a half, but there is a new, as you just alluded to, SARS-like virus.
So this is really fascinating.
Saudi Arabia.
So this virus was first discovered in Saudi Arabia about a year ago. There are now about, I think about 100 cases, about half the people have died. It's a brand new agent. It's in the same category as the SARS agent. So we know SARS was a pretty big problem. Saudis have been very good about being very open, and the medical care in Saudi Arabia is quite good. But that's where the Hajj is, this amazing, unique event where you bring 2 or 3 million Muslims to Mecca. They gather for a week and then they go back around to the whole world. So there's been a lot of worry about what this MERS agent, how Saudi Arabia should handle this. And they've been a very, very good custodian of Mecca and Medina, the two most important sites in Islam, and they've been very serious about trying to minimize the impact. What the World Health Organization and Saudi Arabia is going to do about the MERS challenge to the Hajj is going to be absolutely fascinating. It's in October.
In October of every year. It's in October. But well, that's something to really be keeping our ears and eyes open to, isn't it?
Yeah.
That will be very important in terms of public health. Very important. Well, thank you so much for coming down and explaining a lot about Lyme disease and giving us some little windows here into these other things that perhaps we can have you back sometime and
It'll be a great
go into
pleasure.
more detail.
So 20 years is too long between visits to you.
It's so long. It is way too long. Thank you so much.
Okay, great.
Thank you too for being with us. We'll be back again next week. Until then, have a good week.